Hi, I'm Irene Fernandez and I'm presenting a PET processing tool to detect endocarditis developed by the Biomedical Engineering and Telemedicine Center of the Universidad Politécnica de Madrid and the Hospital Universitario 12 de Octubre, which has been part of my bachelor's thesis. Endocarditis is an inflammation of the heart's inner lining called the endocardium, usually caused by bacteria. It may be generated by several factors, including the presence of a prosthetic valve in which this thesis is focused. Due to high morbidity and mortality rates of endocarditis, despite being an uncommon pathology, several types of imaging techniques are currently used to provide an accurate diagnosis. The latest medical advances in infective endocarditis mean a better prognosis in the life expectancy of patients suffering from it. However, on several occasions, the results of the medical examinations and tests result in wrong diagnosis of the disease and consequently of the treatment applied, whether antibiotic or cardiac surgery. The main disadvantage of all of them is the difficulty in the localization of possible infections. Therefore, it is vital to solve this impediment in order to improve the prognosis of the patients' lives. This work is based on the creation of a tool for FDG PET-CT image processing and aims at the exact localization of the prosthetic valve that generates the endocarditis infection and the quantification of the metabolic activity. For this purpose, the tool contains 5 windows. In the first one, the user must choose between loading a single patient or a list of patients so that another patient's images can also be processed without closing the tool. Once the patient is selected, the second window is loaded as well. At this point, the tool shows the patient's CT images in the 3 planes, axial, coronal, and sagittal, so that the user can make a first segmentation of the prosthetic valve. When starting working with this window, 3 ellipses are drawn, 1 in each plane and in specific slides, creating a 3-dimensional ellipsoid so that the user can create a subvolume containing the patient's valve. To facilitate the segmentation, when a certain ellipse is moved, the other's positions are also updated. This way we make sure that the 3-dimensional ellipsoid is always containing the CT volume required. Once the segmentation is generated, the next window of the tool is loaded, where the user has to orientate and rotate, if necessary, the CT images so that the clearest sliders of the prosthetic valve are shown in the 3 planes. These prosthetic valves are cylindrical, so the horizontal sliders may be adjusted to the center of the valve, taking into account that in the coronal plane must appear a ring form referring to the first plane of the valve's front view, and in the sagittal and axial plane, 2 rectangles may appear, which refer to the upper and lateral views respectively. Once the valve is clearly determined, a 3-dimensional toroid is generated so that the user can adjust its big and small radius and obtain a more specific localization of the valve. After creating the toroidal subvolume, the tool loads its next window in which the patient's PET images are shown with the same slide and rotation values the user determined in the previous window. Once again, the toroid is shown with the same measurements as well, so that thanks to the PET images, the user gets the infection subject values of the radio tracer in the toroidal region, which is the precise localization of the prosthetic valve. Finally, the last window of the tool is shown, in which the final slide of the patient's PET image in the coronal plane is generated and divided in 4 segments, as well as a table showing the maximum and mean values of the toroidal region. This way, the user can interpret the values and determine if there are any infection focuses leading to a possible endocarditis. This novel image processing tool allows for precise segmentations of the heart valves, and the metabolic activity is quantified, which may be altered due to different diseases. The information provided by this software tool can therefore enhance and improve the clinical decision-making process.